Hi, I'm Dr. Geisinger, spine surgeon at McFarland Clinic, here in the Mary Greeley operating rooms to give you an inside look on how we do ACDFs, or anterior cervical discectomy infusions. To start off with, I'd like to introduce the team that all comes together to make these surgeries possible. We have Dr. Mazurek performing anesthesia. Beside Dr. Mazurek, we have Kate, our circulating nurse, who helps coordinate the operating room. Beside her, we have Gina, who helps with the instrumentation aspect of the procedure. Beside Gina, we have Natalie, my physician assistant, who helps directly with the surgery, as well as Vanessa, my nurse, who also helps with the surgery. Behind them, we have Justin, our neuromonitoring specialist, who helps monitor the spine throughout the surgery. Beside Justin in the back, we have Sherry, who helps with the x-ray. All right, now let's take a look at some of the steps to make an ACDF possible. First, the patient is intubated and undergoes anesthesia. After that's done, neuromonitoring is initiated. From there, the front of the neck is then sterilely prepped. After the neck is prepped, we bring in a sterile drape. After the neck is draped, the C-arm then comes in and we take C-arm shots to localize the level that we will be doing surgery on, and a small incision mark is made. Following that, the skin is incised, and with gentle distraction, the front of the neck is then exposed down to the front part of the spine, in which case the discs are then visualized and the appropriate levels disc is removed, and through that window I'm able to decompress around the nerves and the spinal cord. After that's completed, a small spacer is then inserted into the inner space to allow the levels to fuse together, and then a small plate is then attached to the front part of the spine. It looks a lot like this model here, which would be an example of a 2-level surgery. After that's completed, the skin is then closed, a sterile dressing is applied, and from there either a hard or a soft collar is applied. The drapes are taken down. From there, the patient is awoken from anesthesia and taken to the recovery unit. Thanks for joining us for a look at ACDFs.